these paranasal sinuses are considered part of the respiratory system. So they're all lined by a respiratory mucosa. That's right, that's pseudostratified plumbar epithelium cilia. So that the mucosa that lines the paranasal sinuses produces mucus. And that mucus is swept away into the nasal cavity by cilia. So the sinus cavities are constantly drained. And of course, that mucus moves from the nasal cavity into the pharynx and we swallow. We swallow probably 200 to 300 times a day without even realizing it. It's a subconscious thing. But we get rid of that mucus. What happens if you have a rhinitis? Let's say you have an allergic rhinitis where your nose becomes clogged up, or you have a viral rhinitis, an infection. Okay? Well, that nasal mucosa becomes congested. If it becomes too congested, as these membranes thicken, it can close off that opening from the paranasal sinus. If that happens, then this mucus begins to build up like that. Okay? And stagnant mucus can unfortunately serve as a breeding ground for bacteria. In other words, they can use this as a nutrient source and begin to proliferate. And so that's why sometimes a patient can develop a secondary sinusitis from an upper respiratory infection. Because that upper respiratory infection results in obstruction of those openings from the sinus cavities. In fact, I'll say something else here. If you were to, as air passes through the nasal cavity, it reaches the nasal pharynx. So the nasal pharynx sits behind here. Now, it doesn't have a septum, but it's shaped kind of like this. Okay? It doesn't have turbinates. But it does have the same type of respiratory epithelium, respiratory mucosa surrounds it. That's pseudostratified plumbar. And although it doesn't have any sinus cavities draining into it, the eustachian tubes drain into it. Let's draw one of these eustachian tubes. The eustachian tube is connected to the middle ear cavity like this. Here's the tympanic membrane. Of course, here's the external auditory canal, and here's the big old ear. Now, the eustachian tube and the middle ear cavity are considered part of the respiratory tract. They're lined by that same respiratory mucosa, like this. So, just as an upper respiratory infection or inflammation can close off openings from the paranasal sinuses, if that infection spreads to the nasopharynx, it can close off drainage from the eustachian tube, like that. And so in that case, mucus is going to accumulate in the middle ear cavity and can serve as a nutrient source for bacteria. So just as a patient with an upper respiratory infection can develop a secondary sinusitis, they can also develop a secondary otitis media, middle ear infection. Happens a lot in kids because kids have particularly small openings from the eustachian tube. Easy for them to get obstructed. In fact, I like to think of the middle ear cavity as kind of a modified paranasal sinus. So what happens if a kid gets repeated episodes of otitis media?
They put in by tubes.
Yeah, because it can otherwise lead to deafness. So they'll put a little tube right in here. Okay? And what the tube does is it drains any mucus that begins to accumulate. Okay, because without the mucus, the bacteria are not going to proliferate. That's their nutrient source. And so it tends to prevent recurrent otitis media episodes. This is a nice picture here of the respiratory mucosa. Remember that many of the cells are simply ciliated columnar cells, and the cilia are embedded within this layer of mucus, so they can move the mucus. You have goblet cells like this one and this one, okay? The basal cells here, those are the cells that are kind of like stem cells. They proliferate and replace those cells that are lost. And then you have some less common type of cells that we won't go into. We said the pharynx then, when air passes through the nasal cavity, it reaches the pharynx, and that's subdivided into 3 regions: nasopharynx, oropharynx, and laryngopharynx. Again, please don't say nasal or oral, it's one word. Now, sitting along the roof or the posterior wall of the nasopharynx is a pair of tonsils that are called the pharyngeal tonsils. I'll show you, for instance. Here's the nasal cavity here. Behind it here, this area right here, is the nasopharynx. And right here along the posterior wall or roof is the pharyngeal tonsils. What's a more common term for the pharyngeal tonsils? Adenoids. Adenoids. Okay. You'll notice also opening into the nasopharynx on the other side, along the lateral walls, the opening to the eustachian tube. You can call it the pharyngeal tympanic tube or the auditory tube, but most people call it still the eustachian tube. It opens into the nasopharynx. This opening from the nasal cavity into the nasopharynx, represented by the arrow, has a special name: internal nares. That's the internal nares, or another term for this is choani. Choani. So internal nares, just like you have external nares, or choani. If you look at the skull, I've inverted it here, but you can see the nasal septum, right? You can see, and on either side of the nasal septum are the 2 halves of the nasal cavity. Well, that opening here represents the choani, the internal nares.
Where?
So for instance, this opening here and here, that's the opening from the nasal cavity into the nasopharynx.
Okay.
And so we call that the choani of the internal nares. And it's what's represented by the arrow. Now, we think of the pharynx as kind of like a funnel. And the nasopharynx is at the very top of the funnel. If you come down a little bit below the level of the soft palate here, and behind the oral cavity, this region here is the oropharynx. The oropharynx. And seated right between the oral cavity and the oropharynx is another pair of tonsils. That pair is called the palatine tonsils. Those are the ones you see if you get up right next to the bathroom mirror and open your mouth wide. You can see in there. If you haven't had them removed, you can still see them. Okay? Now, look here. If you open your mouth, your oral cavity, you can see the tongue, but you can't quite see far enough back, because along the posterior third, if you could, you'd see the lingual tonsils. These tonsils represent lymphoid tissue, which are part of our immune system. They're there to serve and protect. So we find a lot of lymphoid tissue, okay, where the outside world comes in contact with the inside world. Okay? This is part of our innate immunity. In fact, we have a ring of tonsils all around our mouth and pharynx. It's referred to as Wall-Dyer's ring. Most of the time, this lymphoid tissue, these tonsils, do good. Occasionally, this lymphoid tissue contributes to disease. Okay. For instance, sometimes, particularly in people who are morbidly obese, these tonsils, both the adenoids and the palatine tonsils, contribute to closure of the airways and a problem called sleep apnea. And so those patients sometimes undergo a tonsillectomy. They have both their tonsils and adenoids removed. Sometimes they'll have a uvulectomy. Part of their uvula, all of their uvula may be removed. Okay, to clear up space, to create space in which air can flow. Sometimes you have little children who have recurrent tonsil infections, episodes of tonsillitis, for which ultimately they decide to remove the tonsils. Okay. For instance, sometimes if these adenoids get too big, they can block the opening to the eustachian tube and cause middle ear infections. Okay. So pediatric ENTs do a lot of tonsillectomies and adenoidectomies. In fact, I'll tell you the truth, if you ever go down to a surgical hospital, some of the surgical suites are specialized to deal with certain specialties. So there'll always be one or two rooms that are ENT rooms. It doesn't take very long to do a tonsillectomy and adenoidectomy. 15 to 20 minutes, okay? But yet you can charge about $2,000, okay? So what these pediatric ENTs will do, they'll line up all of their tonsillectomies on the same day. And you'll see, so one ENT will have his day in that little suite. And you'll look at the surgeon's schedule. It's like TNA, 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 TNA. There'll be a list of like 10 of these, okay? And it's just like a mill. They just bring them in, remove them, move them out, Okay. So that's the oral pharynx. See this little structure here projecting up? That's the epiglottis. That's a valve-like structure that serves to cover the laryngeal inlet. Okay? Once you reach that valve-like structure, the epiglottis, you've moved from the oral pharynx into the laryngeal pharynx. So this area here is called the laryngeal pharynx. Okay? It can deliver air into the voice box, or alternately, it serves as a passageway into the esophagus. When you swallow, feel your larynx and swallow. See what happens. If you're functioning normally, your larynx should move upward. So when you swallow, your larynx moves up, and this little epiglottis tilts down, so that when you swallow, you cover the laryngeal inlet, the entrance into the larynx, so that food and beverage have no choice but to pass through this more posterior region into the esophagus. Now, if you're rushing to eat sometimes, your mom says, be careful because food can go down the wrong tube. Well, this is the tube she's afraid of. Okay. because you were Russian, it'd be bad. Yeah.
So that's why sometimes they like cough violently.
Yes.
Trying to, like,
Yeah, if anything gets inside, okay, the larynx, you're gonna start coughing badly, trying to expel it. It's a defense mechanism. Okay. And then notice inside the larynx you have these two little folds. The upper one is called the vestibular fold, or the false vocal cord. The lower one is the true vocal cord. Now, what I've done here in this picture is we're looking at the pharynx, but by opening its posterior wall. So we're looking at it from behind. So we're looking through the cornea eye into the nasal cavity, and we can see the turbinates. You know, the purpose of the turbinates is simply to increase surface area across which air has to move. So you can more easily warm up and filter that air. Here's the soft palate, okay, sitting below the nasopharynx. It gives rise to the uvula. When we reach this level here, behind the oral cavity, this is the oropharynx. And here projecting up is the epiglottis. The epiglottis is capable of tilting over and covering this opening into the larynx. Okay, so where is my hand right now? In what organ?
The larynx.
No, this is larynx. My hand right now is in the esophagus. Esophagus. You'll notice when you dissect the dogs that the trachea sits right in front of the esophagus. They're only connected by a real connective tissue, loose connective tissue, which is very easily dissectable, even with just your fingers. Okay. Now, how can we examine the larynx? We can either examine it directly